Hi, Assalamualaikum. I'm FIRDAUS bin ADENAN. I'm a student of Bachelor Medical Health Science from PJ Medical Learning Center. Today, I would like to present about cervical spine injury. As introduction, head injury had been the fifth commonest hospitalization in Malaysia. Most of cases related to motor vehicle accident. Major trauma about 86% related to head and neck injury. Many lives could be saved with appropriate assessment, treatment, stabilization, rapid transportation with alleviate secondary injury. From the lesson or objective, today you will find about basic anatomy of cervical, basic physiology of cervical, etiology of cervical injury, sign and symptom of cervical injury, investigation in radiology, management of cervical injury, and last but not least, application and simulation of cervical collar. Cervical spine injury is about the cervical anatomy. Cervical anatomy is located on the top of vertebral column, which consists of 8 cervical vertebra. In fact, the cervical is being susceptible to the injury due to its own flexibility and anatomy compared to other compartments of spine, according to Tolikasi 2020. CSI is injury occur at 7 cervical vertebra that serve as protection to spinal cord. From this slide, you will know about cervical physiology. Commonly, cervical physiology is about the functioning of cervical. The functioning is cervical consists or including of flexion, extension, rotation, lateral bending, dissection or stretching, and compression or axial loading. Okay, let's move on to the etiology. Generally, etiology of cervical spine injury is related to the history of high impact injury that had been major cause of CSI. High impact injury maybe can be view of motor vehicle injury or motor vehicle accident, fall from height, or sport injury. Cervical spine injury patient, we could had a lot of signs and symptoms according to the guideline to diagnose the cervical spine injury or treated it. One of the signs and symptoms we can go through the NEXUS criteria. What is NEXUS criteria is all about the NSAID. There is a no posterior midline cervical tenderness, no evidence of intoxication, normal level of alertness, no focal neurological deficit, and no painful distracting injury. Besides of NEXUS criteria, you can evaluate the spinal cord injury through the tool of spinal emergency evaluation of deficit, or you can call it SPEED. What is SPEED? SPEED is about the how to evaluate the spinal cord injury through the motor scoring. You will give instruction to the patient to move on the toe or ankle, or you can go through about sensory scoring by giving the light touch on the lateral side of calcaneus. Besides that, you can evaluate through the SPEED tool with the exclusion high cervical injury to the light touch of the C3 and confirmation of cervical spine cord injury with the instruction given to the patient. Can you squeeze my hand bothly with the closed eye? And last but not least, approximately location of spinal cord through the palpation procedure. Okay, now we move on to the diagnostic in cervical spine injury through the radiology view. From the radiology view, we go from the X-ray. X-ray is not much we can determine the cervical spine injury unless there are obvious fracture on the cervical injury or vertebra. But from the X-ray, we can view of the anterior vertebral line, posterior vertebral line, spinolaminar line, and we can go through a posterior spinous line. In radiology diagnostic, commonly X-ray cannot define the detail about the cervical spine injury. So we proceed with the CT scan for the diagnosing the cervical spine injury. Last but not least, in radiology diagnostic, we can ending with the MRI. From the MRI view, we can conclude or obtain the detail of the spinal cervical spinal injury as well. Then how about the management of the cervical spine injury patient? So we're starting with the primary survey, all about danger. Is there any danger to the patient? If got danger to the patient, please remove the danger from the patient or patient to the from the danger as well. Then evaluate the response of the patient. If patient got any problem with the airway protection, please secure the airway first. Then put the cervical in line, and this procedure will support with the tool of cervical column. From the criteria of NEXUS or the S.P.E.E.D or the Canadian Spinal Cord Injury Guideline, you can conclude that or inspect or throughout the patient if the patient got any cervical spine injury. Then we evaluate the others life-threatening condition such as pneumothorax, cardiac tamponade, open chest wound, flail chest, or about cardiac contusion. Then from the next stage, we go after the bleeding is about circulation. On the scene, maybe you need to get the IV access, and please avoid or minimal the IV fluid if you want to giving to the patient as well. Then evaluate the disability about the GCS, evaluate about any deformity, and last but not least, we giving an extra or extrication to the patient to move out from the vehicle or move out from the danger side to the safer side for further treatment. Okay, we will move on about the application and simulation of cervical collar. Cervical collar is keen usually for the patient with the we inspect the patient that could obtain of the spinal cord injury. So before we proceed with the spinal cord cervical collar, the procedure is all about the period of cervical collar procedure. From the before apply the cervical collar, during apply the cervical collar, and last but not least is post cervical collar apply to the patient as well. Before we apply the cervical collar, we must know the indication for the cervical collar apply. First is about NEXUS criteria. Second is about the Canadian C-spinal rule. Third is about spinal emergency evaluation of defensive or S.P.E.E.D. And last but not least, if the patient got history of high impact injury. Before procedure, we must know about the tool of the cervical collar itself. Second is a type of cervical collar, either adult, fixed, or the rigid or adjustable. Second is about measurement, how to measure the cervical collar to put on the patient. And fourth is about human resource. We have a one-man show or two-man show. And last but not least is about difficulty. Any difficulty including the deformity of the cervical spinal cervical itself, or maybe regarding to the foreign body or bleeding about neck region. Okay, this video I will like to introduce about the tool of the cervical collar. First, we should know the cervical collar itself is about adult or the piece. Okay, I will show you the type of cervical collar in this video. Okay, first of all, you should know about the size of the cervical collar itself. Is this one is about pediatric, or this will show the differences of the size. Okay, I will show you. This one is for the adult. This one for the child. Okay, that's the totally obviously differential. Okay. Second, we should know about the either the cervical collar is the adjustable or the rigid cervical collar. Okay, I will show you. Okay, both the of this cervical collar is for the pediatric one, but the upper one is adjustable, and the second one is rigid cervical collar. Okay, I will show the rigid cervical collar is showed for infant, surely for infant. Okay, for the PEED cervical collar, they are various of color. They show the sizes. Okay, I will show you. Okay, this one is for the infant, blue one color. Okay, second one is for pediatric, green one color. Okay, this one is for the regular, red one color. Okay. Okay, next for the short neck, based on short neck, blue one color. Okay, and the last but not least, this one is yellow color for the neckless patient. Okay. Then how about the adjustable? Okay, adjustable no need to presented with color to show the indicated for the measurement. Okay, so what the speciality of the adjustable? Adjustable, we could if you see this one, okay, adjustable all about the sizing measurement. Either the patient got the non-neck, short, or regular, and last but not least, maybe due to the tall sizing of neck. Okay, then we go about the measurement. Okay, this about is about the measurement. Okay, let's imagine this the patient of the we indicate this patient should wear the cervical collar as well, because the indication of cervical collar itself due to the cervical spine injury. So how to measure it? Okay, first of all, we need to make an imaginary line through the mandible and till the neck of the patient. And after that, you put the finger from the imaginary line until the base of the shoulder. Then from this one, I measured this patient had a measure of 3 finger from my finger. If you got the bigger finger, maybe this patient you got only 2 until the base of the shoulder. Or maybe you had the thin finger, and maybe it's acquire 4 finger for you to get until the base of the shoulder. It's based on your finger sizing, and most importantly is about the sizing, adequate sizing for the cervical collar based on your measurement. Okay, before we proceed with the cervical collar demos, okay, from the video before, I did give you how to measure the cervical collar based on patient measurement. Okay, then based on the patient I showed before, the patient required 3 finger, 3 of my finger from the imaginary line to the base of the shoulder, Then from the three finger, you should put on the cervical collar. Okay, from this view. Okay, do you know that the last finger is show the for the regular neck measurement. Okay, then you just move click, pull out the button one and this one. Okay, then you just move on to the regular one. Okay, then just press this button. Okay, to fix it. Okay, this one fix. Okay. Okay, then only you can put on the patient. Okay. Okay, during the installer of the cervical collar, means during the procedure, you should evaluate the position of the patient itself, because based on the position, we could deliver the treatment based on variety of technique to apply the cervical collar. And last but not least, you should consider about the ethical issue from the installation or simulation of the cervical collar. Okay, I'm short of the human resources because I'm the only one for the one-man show cervical collar demos. Okay, but I not let you down. Okay, I will show you how to make a cervical collar installation. Okay, so from view, the first one I mentioned before is about the positioning of the patient itself. Okay, let's say if the this patient is on the sitting position. Okay, you should have one extra man to hold the positioning. Okay, the first man will hold the positioning is about this one. Okay, make sure he hold the patient adequately. Okay, the second one is mine to put the cervical collar itself. Okay, the second we'll put on after the measurement, we'll put the on the patient just like this one. Okay, then while the first will hold, then the first they will keep the cervical collar as well. Maybe the measurement is 3, but we could adjust because this one is adjustable. Okay. 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 Then you should hold like this one for the second rescue. Then just put it. Why the first rescue is maintenance the head positioning. Okay, this one for the sitting positioning. Okay, let's say if the patient is supine position. Okay, for the one man show, you should put left finger on the left if your hand finger is dominant. Okay, left hand on the head of the patient. Okay, on the forehead of the patient. Okay, the right hand of your dominant hand put the cervical collar below the neck region until the end of the cervical collar, this one, is visible. Then you can pull off the straight one. Okay, after you put off the straight one, this hand finger, make sure this hand finger you do not remove it until you put the cervical collar by your right hand dominant. Okay, just this one. Okay, then after you hold the neck, then only you release the left hand and straight the patient as well. Okay, simple, right? Okay, after we apply the cervical collar, on the post-op procedure, we should alert the patient if there any discomfortability, if the patient alert, and evaluate any sign of intracranial increase, such as vomiting, intra-articular pressure elevate, then any aspiration, then last we should know about the pressure sore if the patient not comfortable. Is there to tightness, is about the tightness itself. Okay, then how we evaluate the tightness? We just put the two finger on the left and on the right. Is there the cervical collar is the rigid or fixed for the patient, or is too tight for the patient? And last but not least, the cervical collar will avoid the patient for the extension of the flexion movement of the neck, which means the functioning or goal for the cervical collar apply for minimum movement is achieved. Okay, that's the references for my slide. And we proceed with the question one. Is how long to keep the cervical collar? Okay. No, don't mind about that question for the how long to keep it, but focus on is there any instruction for from the medical officer about to remove the cervical collar due to no indication to keep it. Second is until the patient is proven that there is no cervical spine injury as well. Second question is which one of that cervical collar that healthcare provider preferred? Okay, for me as a healthcare provider, I will prefer to choose the adjustable cervical collar, because adjustable could adjust the on the patient itself if the patient is not comfort. Okay, I will show you a demo. Okay, let's say if this patient complain that the neck is too flexy to move, or is too tight or not accurate for the measurement, so you just click off this button and this button. Okay, to adjust this one, adjust the neck this one. Okay, so actually we need to adjust it unilaterally at the increasing or downgrade this cervical collar, then click this one after fit it. Okay, then the cervical collar, adjustable cervical collar is more preferred for the healthcare provider despite of fixed cervical collar. Okay, that's all from my video. I would like to thank you for all the frontliner or all the Malaysian for the participate for COVID-19. I would like to say that we hope we could fight the COVID-19 for our future as well. Thank you.